Okay. Now we're going to go over the initial setup of a LymphoPress Petite Basic. This pump is fairly easy and self-explanatory, but we'll go over some of the finer points. First is your sleeve setup. When you receive these packages, there are going to be sleeves in a plastic bag and separate hose bundles. These hoses have to be connected to the sleeves in the appropriate places, but they're all color-coded. So, yellow to yellow. Press it in firmly until it bottoms out most of the way. They're not going to fully insert all the way, but that's okay. Green to green. Sometimes they're a little, some of them are a little tighter than others, so just make sure they're in there fairly firmly. Purple to purple, and pink to pink. Well, these connectors are very simple. They just simply snap into the pump, and there's only one way that they can fit. You can't insert them upside down. So the logo goes up, snaps right into the pump, like so. If the setup for the patient includes two sleeves, you're going to connect both sleeves to the outlet with the holes. This little blocker is also supplied in the box. This can be held right here in this open space for the patient to use in the future if they need to disconnect one of the sleeves and just use the pump on one extremity. If the supplied pump only comes with one sleeve, you're going to hook up the one sleeve, take the blocker piece, and insert that into the outlet for the other sleeve, like so. Setting the pressure on these, you simply turn the bottom knob to what is indicated on the script. It's usually 40 or somewhere in that area. When you're done that, this little tiny screw at the top, you tighten clockwise. This locks the pressure in place so that it can't accidentally be moved. The top button sets the amount of time that the pump will pause in between pressure cycles. This is usually started at 20. When the patient uses the pump for the first time, if they experience numbness in their feet or lower legs, this can be increased by the patient up to the point where they'll be able to use the pump for the full treatment duration without getting the numbness. So this can go anywhere from 10 to 70 seconds. Obviously, the longer the pause setting is, the less pressure cycles the patient is going to get for every hour of treatment. So they will want to have this as low as possible without experiencing the numbness in the feet. We usually have this on 20, and that works well for most patients. So that is going to be your starting point on that. To run this pump, the power switch is on the right hand side around the corner from the front knobs. Just simply flip the switch, the patient gets comfortable and lets it run for the amount of time that the doctor prescribed.